Another major topic is acquired resistance. This is especially relevant for anyone on targeted therapies. What tends to happen is as patients remain on targeted therapies, cancer cells eventually figure out ways to develop resistance to that targeted therapy. This can come in the form of on-target resistance, shown on the left-hand side here. These mutations typically occur in the tyrosine kinase domain, and what that means is they block the ability of the drug to get into the binding pocket. And so this category of resistance is called on-target, and the treatments can vary, but usually involve some kind of trial drug that can overcome this on-target resistance. The other mechanism is something called bypass signaling, or in this slide, it's called oncogene kinase switch. And the idea here is that the original oncogene, let's say in this case, EGFR, which is in the middle of this green receptor shown here, the drug is still blocking this EGFR receptor. And this mutation is not allowing, or is not able to continue to have cancer cells grow. So what cancer cells do in response is they co-opt or hijack other pathways. And in this picture, these include ERB2, ERB3, MET, and AXL. Now, there's many more than that's shown on this slide, but these are representative examples that are representative examples of bypass signaling, and really highlight the concept that cancer cells can be inhibited in the primary mutation pathway and recruit other pathways to survive. So combination strategies here are being looked at in a variety of different trials. This is a proof of concept case report that was published from our group back in 2017, looking at a patient who was on osimertinib. This is a targeted therapy that blocks EGFR mutant non-small cell lung cancer. This patient unfortunately progressed in the belly, and you can see all this fluid in the abdomen that was developing from his cancer not responding to the osimertinib. It turns out that this patient had a bypass signal through a pathway called the MET pathway. And it turns out there was a drug that can block the MET pathway. And so the combination of osimertinib plus a drug called crizotinib was given to this patient, and you can see significant shrinkage in the fluid in the patient's abdomen.